Good afternoon, everybody, and thank you for joining us for London Health Sciences Center's December 2025 Community Update Meeting. So before we begin, I want to turn things over to Tammy Quigley, who's the Vice President of Cancer, Renal, Mental Health, and Patient Flow, to share a land acknowledgement. Tammy?
Thanks, David. Good afternoon. It is with deep gratitude and respect that I acknowledge that London Health Sciences Centre, including Children's Hospital, is situated on the traditional lands of the Anishinaabeg, Haudenosaunee, Lenape, and Chunungtung peoples. This land is covered by the Dish with One Spoon Wampum Belt Covenant and by Treaty 6, the London Township Treaty. The three Indigenous nations that are neighbors to London are the Chippewa of the Thames First Nation, Oneida Nation of the Thames, and Munsee Delaware Nation. As we mark the end of the year and look to the next, it's a time for us to reflect not only on our accomplishments, but also on our responsibilities to Indigenous peoples, including honoring treaty relationships, supporting Indigenous-led initiatives, and deepening our learning about this land and its histories.
Thank you, Tammy. So it's great, again, to be here today connecting with all of you. So just a refresher is regarding these meetings and what they're meant to have happen for not only you individually, but for the region, is it's a great opportunity for LHSC to share what is happening within its four walls and even outside of its four walls, and to celebrate the work of the teams and the impact they have on our patients, families, and communities. So these meetings are live streamed through YouTube, and a recording is also made available afterwards. Our meetings are also replayed on Rogers TV London. So each month, we highlight examples of how our staff, leaders, learners, volunteers, and patient partners are improving care, advancing research, and supporting one another. These meetings are also a space for transparent conversations, giving you a chance to see this progress, hear about our achievements, and understand the challenges that are ahead of us. As always, I really want to thank everyone who continues to join these sessions and stay engaged in the work we're doing. Your involvement definitely helps shape these conversations and keeps us focused on what matters most. So before we get into this month's presentation, I want to take a moment to acknowledge that December is, as Tammy indicated, always a time of reflection, a chance to look back at what we've accomplished and also the people who made it possible. So with that in mind, I want to take a moment to highlight and spotlight the impact that research and innovation continues to have across our organization. So I'm proud to share that London Health Sciences Centre Research Institute, or what we call LHSCRI, ranked 13th in the country in Research InfoSource's 2025 Top 40 Research Hospitals list. That ranking measures hospital-based research and its institutes across Canada by looking at funding and research activity. LHSCRI also ranked first for research intensity among large tier institutes. So with more than 2,300 active clinical research studies across our many clinical programs, the Research Institute is advancing diagnostics and treatments that directly benefit patients. So this year's findings include promising work in imaging for cancer, improved detection of hidden blood clots, and investigation into links between cannabis and psychosis. So these results clearly reflect that our research teams, our clinical staff, and partners make innovation possible. So I really want to thank everyone involved in moving research from an idea to actual impact. So in speaking of research partners that strengthens care, we recently reached a milestone for one of our newest collaborations. So in August, we marked the 1-year anniversary of our affiliation with Shriners Hospitals for Children Canada. So that partnership has already led to meaningful work, including the launch of the STAR program, which is a pan-Canadian research initiative focused on rare childhood bone disorders. So the STAR program received a joint $400,000 grant 2 years ago and is built around three main pillars: a clinical registry to track conditions, hands-on projects that connect lab research with patient care, and a learning network that helps teams share knowledge and train together. So this initiative brings clinicians and researchers together to study rare bone disorders like genetic rickets, and with the goal of earlier diagnosis and more personalized treatment for children across Canada. It's an important example of how strategic partnerships can expand access to specialized care and accelerate research. So the STAR program's already tackling real-world patient challenges. For example, it studies how rare bone disorders affect children differently, allowing researchers to design more personalized treatments. So by combining lab research, patient data, and clinical expertise, the program is helping move discoveries from the lab to actual patient care faster. As the program grows, it's going to aim to include additional rare bone conditions and open its platform to collaborate across Canada, strengthening access to care in children in every region. I also want to highlight that December is a time when the compassion of the team LHSC shines, especially through our holiday drives. The holiday season is a time for giving, and our team really leaned in during this most recent LHSC's holiday food and winter clothing drive. So this year, we're proud to partner with London Business Cares, joining more than 300 local organizations in supporting the London Food Bank and community programs across our region. So thanks to the generous donations from across our team, hundreds of items, including non-perishable food, warm winter clothing, and hand warmers for babies, children, and adults were collected across Victoria University and Children's Hospital. Each contribution is going to help individuals and families who rely on community resource through the colder months. Also, as we know, the holiday season can also bring schedule changes across primary care, clinics, community services, but health needs don't pause. So it helps to be prepared. If you have a medical emergency, call 911 or go to your nearest emergency department. Our emergency departments are open 24/7, but the holidays are often when we experience the highest volumes of the year. Patients who do not require emergency care may face longer wait times than the most critically ill who are seen first. For non-threatening but urgent issues, there's Virgin Urgent Care is an option for both adults and children and can be booked online. Check your estimated wait times on our public website if you're heading to the ED, which for a non-emergency. I also want to share a few helpful reminders as the holidays approach. Reminders to renew your prescriptions ahead of time, check holiday hours from your primary care provider or family health team, and take a note at which pharmacies or urgent care clinics are going to be open. These simple steps can save time and help you access the right care when you need it. And finally, before I hand things over to Deborah Wiseman, who's our Vice President of Medicine, Emergency Services, Critical Care, and also Dr. Christy McDonald, who is our Interim Vice Chair of our Medical Advisory Committee, I want to take a moment to share something special. As you know, 2025 marked the 150th anniversary, a milestone that speaks to generations of great care, teaching, and research across our organization. To recognize this moment and to extend our gratitude to everyone who supports LHSC, we've created a short holiday message that reflects the heart of our people and the community we serve. I'd like to share that with you now.
For 150 years, London Health Sciences Centre has been part of life's many seasons. And this holiday season is no different. Across generations, through wars, pandemics, and times of progress, our people have remained a steady presence providing compassionate care, advancing medicine, and supporting one another every step of the way. From the earliest days of LHSC to modern research breakthroughs, our commitment to our community and those we serve has never wavered. This holiday season, we pause to reflect on that journey. We celebrate the seasons that have shaped us, and we look forward with hope to the ones ahead. For 150 years, through every season, we have stood together, and we will continue to do so in the next 150 years to come. Happy holidays from all of us at LHSC.
What a fabulous video opportunity to share our history. We have been celebrating that 150th this year, so certainly excited to see that video with you all today. As I start my time with you today, I want to take us back almost 50 years to 1975, when living donation was still very new at LHSC. It was considered a very bold step at the time, but opened the door to something life-changing for patients with kidney failure. Living donation is a process where a living person donates an organ or a part of an organ to someone in need of a transplant, and most commonly kidney or possibly liver. Living donors can be family members, friends, even altruistic individuals who wish to help someone in need without any personal connection. On the screen, you see Mary Ann on the left. She's one of these patients. Her kidneys gradually failed, and by her mid-20s, she was relying on dialysis while trying to raise 2 young children. When her sister Margaret, on the right, offered to be tested as a potential donor, no one expected them to be such a close match. Almost perfect. Their surgeries took place on November 19th at University Hospital, and both did incredibly well. Mary Ann noticed the change right away. She felt stronger, healthier, and she got back to the life she loved. And Margaret recovered quickly as well. It became one of the earliest examples of how living donation could truly change someone's future. For those doing the quick math, that means Margaret and Mary Ann reached their 50th transplant anniversary in November of this year. What an incredible milestone. While we celebrated the milestone of these beautiful sisters and their story, this milestone also reflects how far transplant care has come. The science is stronger, medications are improved, long-term outcomes have also improved dramatically. Their success is an incredible opportunity to remind us all of that progress. It was also a proud moment for our transplant program. Their story is part of our history, and it highlights the expertise and dedication that our teams have shaped in the work that has occurred over the last 50 years. As I wrap up their story, this milestone really does represent generosity, family, and the kind of care that gives people decades of healthy, meaningful life. Their story continues to inspire patients, families, those of us who care for them, and others that are just beginning their transplant journey. And it reminds our team that this work matters. It shows the impact of a single act of giving and the lasting difference it can make. A powerful part of LHSC's transplant legacy and a moment worth celebrating. Mary Ann and Margaret's experience shows how innovation in transplant care can change the course of somebody's life, and what a remarkable spirit of progress that has carried through the journey of surgery that was possible in 1975 and still alive across today at LHSC. Changing gears a little bit, I want to talk about a story that's a little more present for us. And while our transplant story demonstrates a half a decade of transplant excellence, I want to share a much more recent story that shows how our teams continue to advance treatment options for patients in our region facing other types of medical conditions. This is about a milestone in sickle cell care at LHSC. Sickle cell, which we've talked about previously, is one of the most common inherited blood disorders and disproportionately affects Black patients. For adults living with sickle cell disease, treatment options are limited. It's why the work happening here at LHSC is so incredibly important. In November of last year, 2024, our teams completed the first adult stem cell transplant for sickle cell disease here since 2007. It was a significant partnership between our lifespan hemoglobinopathy program and our blood marrow transplant program. Being able to offer this care locally means patients don't have to leave their community for the care that they need, and offers a potential curative treatment. It represents years of strengthening expertise, partnerships, and access to equitable care. You may be wondering what sickle cell disease, and in more detail, we're going to share that story more fulsomely in a presentation that follows this one. Progress around these types of illness becomes very real when you look at someone like Jamari. He's featured on the left here. He's lived with sickle cell disease since birth and spent much of his childhood and teen years navigating serious pain crises. As an adult, he became a strong candidate for transplant with a full sibling match. Originally, he expected he would need to go elsewhere in the province for this procedure, but with renewed capacity here at LHSC, we were able to support him close to home. It was an overwhelming experience at first, as anyone would expect, but he had support from family, care teams, every step of the way. His recovery has been very encouraging. His symptoms have improved, his follow-up care is now consistent, and he describes himself feeling no longer that he has sickle cell disease. He's preparing to start college in January 2026. We're all wishing him very well in that journey that he's been looking forward to doing for such a long time. His story does highlight how collaboration, innovation, and equitable access to care can open doors for patients' futures. Finally, I'd like to share with you a highlight around delirium, an important opportunity that some of our patients do experience. In November, we proudly displayed our Ontario delirium flag, joining the province-wide initiative to spread awareness and strengthen commitment to reducing delirium. Beyond the flag, our teams are creating real change in how we support these patients who are at risk. Delirium care here at LHSC starts with prevention. Across medicine, surgery, clinical neurological sciences, and other teams, we use early and routine screening to identify patients at risk. By working closely with patients, family, care partners, and others, we focus on prevention where possible. When delirium does occur, our teams act quickly with early interventions to support recovery and minimize the impact on thinking, independence, and overall function. A special example of one of the many interventions is delivered by our recreational therapists. These individuals on our team may bring in watercolor paints for patients who once loved art. They might provide iPads so patients can connect with family, watch their favorite shows, or they may offer comfort items like fidget blankets, weighted dolls, or puzzles that stimulate the mind. These personalized activities do help reduce decline. They shorten our hospital stays and increase satisfaction for both our patients and their families. By integrating recreational therapy into patient medicine, which is rare in acute settings, LHSC is driving a culture of change in how delirium prevention is approached. Raising the delirium flag was a visible reminder of our commitment and the progress we're making together. Our work continues. I'm going to pass the screen on to Dr. Christy McDonald now, who's going to share with you a current respiratory update. Wishing you all a very safe and happy holidays. Christy, over to you.
Great, thank you very much, Deborah. Shifting now to our local respiratory picture, we're seeing an increase in respiratory illnesses this season, including influenza, COVID-19, and other seasonal viruses. Transmission is very active in our community, including within long-term care, congregate care, and schools. So awareness of early symptoms and taking simple precautions continues to be very important. Hospital activity is rising with more admissions, more emergency visits, and more outbreaks, which put pressures on our inpatient wards, our intensive care units, and on our staff. This is resulting in longer than usual wait times within our EDs and transfers to inpatient units. We continue to be here to provide care to our community. Our teams thank you in advance for your understanding as we continue to surge. Our LHSC team continues to work to provide seamless care as we experience this year's respiratory surge. At the provincial level, positivity rates can be used to provide an estimate of the intensity of circulating viruses in the province. Right now, influenza is the main driver of respiratory illness as we move further into the season. It's an important reminder of the value of prevention, especially vaccination. When we look at COVID-19 specifically, we're seeing much lower numbers than this time last year. There were 15 positive tests in the most recent week, compared with 67 during the same week last year, which is nearly an 80% reduction. Total testing volume is approximately the same as last year. This reflects all tests placed at LHSC across our emergency departments, our outpatient units, inpatients, and partner sites like St. Joseph's and other hospitals, including St. Thomas Elgin General Hospital, Woodstock Hospital, Middlesex Health Alliance, and Rural Roads Health Services. COVID-19 is still circulating, but it's not the primary driver of respiratory illness right now. Influenza, on the other hand, is rising very quickly. There were 163 positive tests in the most recent week compared to 7 at the same time last year. This represents a significant increase. Total testing volume is approximately the same as last year. Testing is slightly lower, about 100 fewer tests, but it includes all influenza tests placed at LHSC, as well as our partner hospitals like St. Thomas, Woodstock, Middlesex Health Alliance, and Rural Roads. Right now, influenza is the main contributor to respiratory illness in both our hospitals and within the community. This flu season, most cases in Ontario are caused by influenza A, the variant H3N2, which is slightly different from the strain in this year's vaccine. Even so, the vaccine still works to reduce serious illness. For children and teens, the flu vaccine provides about 72 to 75% protection against hospital visits. And for adults, protection is about 32 to 39%, helping lower the risk of severe illness. The vaccine also protects well against H1N1 and influenza B, which are circulating right now. Getting vaccinated reduces severe illness, hospital visits, and deaths, and it's especially important for residents of long-term care and retirement homes. When recommended, flu shots can be given at the same time as COVID-19 or RSV vaccines. Even if the flu strain is not a perfect match, the vaccine still provides meaningful protection for you and for those around you. Respiratory virus activity in our region continues to rise, and we haven't yet reached the seasonal peak. Based on our current trends, the peak is expected earlier than usual, likely in late December, just after our holiday season. Influenza remains the main contributor to illness in our hospitals and the community. As a major regional hospital, LHSC has a responsibility to protect our most vulnerable patients, including those in cancer and pediatric care, and to also reduce the transmission within the hospital while supporting the broader community. To do this, we have introduced several updated safety measures. Starting December 15th, all healthcare workers will wear masks during direct patient contact in both inpatient and outpatient settings, while masks remain optional in non-clinical areas. Patients and visitors are encouraged to mask, especially if they are symptomatic or in high-risk clinical areas. In addition, we are implementing enhanced infection prevention measures across clinical areas. These steps are part of LHSC's ongoing commitment to keeping patients, visitors, and staff safe throughout the respiratory season. Staff are reminded to stay up to date with vaccinations and follow return to work policies if unwell. We'll continue to monitor the situation and update measures as needed. And finally, here are a few simple things that you can do to not only protect yourself, but protect those around you. Stay home if you're sick, wash your hands often, wear a well-fitted mask in crowded or clinical spaces, improve indoor airflow when you can. Adults 75 and older should discuss RSV vaccination with their healthcare provider. And vaccines really are the most effective way to prevent serious illness. These small, practical actions help protect you, your family, and our community. As Deborah had mentioned, we've celebrated our 150th year of LHSC. This has been a year, it's been a very special one as we've celebrated our history. Across the organization and within our community, we've seen events, exhibits, and storytelling that highlight the people and partnerships behind our work. It's been inspiring to see the creativity, the energy, and the enthusiasm across our teams, and the meaningful connections formed throughout the year. Marking 150 years has been about more than looking back. It's been about celebrating who we are together. For both of us, being part of these celebrations has been incredibly meaningful. It's been a privilege to work with our teams, our partners, and our community organizations to bring these stories to life. For seeing how patients, staff, and volunteers connected with the history and the celebrations, it really reminded Deborah and it reminded me of why we do this work and why it matters. We hope this inspires you to explore the LHSC 150 website and take in the incredible stories shared by people across our communities. Again, have a very healthy and happy and safe holiday season. We'll now transition over to Kathy Wood, the Interim Director of Equity, Diversity and Inclusion and Black Health Lead, and to Dr. Ziad Soul, Medical Director, Transfusion Medicine, Adult Hemoglobinopathy Program, and Department of Medicine, LHSC. They'll talk about advancing care for patients with sickle cell disease. Over to you, Kathy.
Well, welcome and thank you. I will turn it over to Dr. Ziad Soul to begin the presentation.
Thank you, Kathy and Christy. Thank you for the introduction. We're very excited to update everybody about our excellent work that we've been doing regarding improving the care of patients with sickle cell disease living in our community and the region. First, a word on what is sickle cell disease. It may be a new term for a lot of folks in the audience today. So sickle cell disease is actually one of the most common genetic disorders of the blood. It's a disorder of hemoglobin. Red blood cells become crescent-shaped or sickle-shaped, which blocks the blood flow, and it causes pain and complications downstream in multiple organs that are waiting for the blood and the oxygen to reach them. So our patients face a lot of complications and challenges related to this genetic change. One of the complications that is most severe is stroke, which results in a variety of different neurological deficits, unfortunately. However, one of the hallmarks of this condition is a recurrent severe pain, which is the last item on the screen there, so vaso-occlusive crisis pain. As well, patients suffer from acute chest syndrome, which is one of the leading causes of death, unfortunately, in this population. They may also have pulmonary embolism, liver disease and gallstones, kidney disease from chronic lack of blood flow to the kidneys. Actually, one of our patients underwent a kidney transplant a few years ago. Our patients also suffer from infections due to a lack of a functioning spleen. So they become immunocompromised and they might suffer from osteomyelitis or blood infection, which is called sepsis. Children specifically might have something called splenic infarction, where the spleen stops working, or it might take up a large volume of the blood, and they might have low blood pressure from that. Women that are pregnant and have sickle cell disease have a lot of complications, both maternal complications for their own health, but also fetal complications and placental compromise, which leads to preterm birth, for example. And then there are complications for the baby. So we work closely with our maternal fetal medicine colleagues to optimize their health. So facing all of these complications, we've built a team over the years, a comprehensive care team who really addresses all of their care in a comprehensive way. As was mentioned earlier during this talk, our patients come predominantly from Black ethnicity and also from the Indian Peninsula, the Middle East, Jamaica, and so quite a varied population, but all ethnic minorities. So health inequities have been part of their history in the Canadian healthcare system, and London Health Sciences Centre is working to close that gap very, very well and very quickly. And Kathy will be discussing some of the specific challenges in the emergency department and other areas that we have succeeded in. But our population has really benefited from working closely with the Black Health Office at the London Health Sciences, which has been recently established. Where are we in London? When I started here about 8 years ago, I had about 10 patients with sickle cell disease. Now we have over 200. London is definitely growing extremely fast. It is, as you all know, the second largest growing region, to my knowledge, in all of Canada. So no wonder we now have over 200 patients. As an aside, we also take care of patients with thalassemia, which is similar to sickle cell disease. So this number is growing rapidly, and we get new referrals every week. We don't only cover the London city limits. We provide expertise and care to patients that may seek our expertise all the way from Windsor, Chatham-Kent, Stratford, Sarnia, Woodstock, St. Thomas, Kitchener. We even have patients in the very northern parts of Ontario who seek care, and we do offer them video virtual visits or in-person visits. So overall, Ontario has half of all of our sickle cell disease patients in Canada, so about 3,500 in Ontario and about 7,000 across Canada, and growing. And I will gladly hand it over to Kathy Wood, who will speak of the challenges that our patients are facing.
Thank you so much, Dr. Saul, for providing that very important context for sometimes a lesser known blood disorder. So, we were fortunate at LHSC to submit and receive special Ontario Health funding in order to implement and advance kind of guidelines from Ontario Health, and those are sickle cell standards, and it's about standards for care. And so our aim in improving the health and health outcomes for sickle cell patients really align with that document from Ontario Health on how sickle cell patients should be cared for in a timely and efficient manner. And so through that grant funding, we were able to do some purposeful interviewing of our patients, as well as feedback that we received through daily interactions with sickle cell patients. And so what we were hearing from our patients is that patients reported, not unlike other patient populations, that upon visiting, they're being asked the same repeated questions by various providers, and that's when you have frequent admissions, that can really be challenging to kind of tell your story over and over again, especially when you are in extreme or an acute pain crisis. And so we're enduring long wait times within the ED department. And again, when you're in severe pain, that can be challenging for patients. They also reported feeling unheard, dismissed, and maybe that their pain wasn't as severe as they were reporting. And so patients are also having difficulty navigating this very complex healthcare and hospital system that we have today. Additionally, as Dr. Saul said, our catchment area for patients needing sickle cell care, being a sickle cell designated center here at LHSC, that patients are also having to travel, experiencing a lot of cost and time burden to receive the care in the hemoglobinopathy clinic. So taking what we've heard from those patients and knowing that 68% of patients who present to the emergency department end up being admitted to hospital for a stay of various lengths. We worked with the medicine department, the medicine team, and they initiated a project last spring that really looked to improve the care experience and the outcomes for sickle cell patients. And what they were able to accomplish was truly remarkable in a short period of time. So what we have now is dedicated area within the medicine unit where sickle cell patients will be cared for by specially trained nurses. They'll have access to experts like Dr. Saul and his team, as well as the acute pain service that will be notified automatically upon admission. We didn't have that before. And so that's really providing that streamlined, continuous continuum of care that patients require when you're experiencing a complex and chronic disorder that brings you to hospital on a frequent basis. As well, every patient who leaves hospital, we are continuing to provide them with a survey just to ensure that we are getting their feedback on a continuous basis so that we can look at where there are areas for us to improve. Improvements have also been made in the emergency department, and that's where a lot of our focus had been. It was the emergency department, again, because so many patients present frequently to the emergency department due to their pain crisis. But the improvements that we've seen already is that patients are being seen for that initial physician assessment a lot quicker than they had been. And again, a remarkable feat for the emergency department and the effort and time they've put into being able to see those improvements. As well, initiation of pain management is happening sooner for these patients, decreasing the suffering that patients tend to go through. We're also having better identification and tracking of patients. Previously, there was manual tracking, and so happy to say that we are using some electronic tracking. So folks like Dr. Saul in the lifespan hemoglobinopathy clinic will be able to know that patients that they are following have been to the emergency department or have been admitted, and then they're able to be part of that patient's care and care journey. So tracking those patients from emergency departments, clinics, and through to inpatient areas. To date, we really want to ensure that staff have the information and the support that's required for them to support patients. And so to date, 60 medicine nurses have been trained. That's 4 hours of sickle cell disease specific training that they are receiving as well. Soon the completion of an anti-Black racism module and a cultural competency module will be required for those that are providing care and across the entire medicine unit. So again, kudos to medicine for really leading that and championing the multifaceted challenges that patients experience and finding ways really to rectify and resolve that. As well, patients are able staff are able to attend and participate in various activities around World Sickle Cell Day and Sickle Cell Awareness Month. And that's important to build trust within the community and also to build on their own knowledge and capacity to care for patients. So the other thing that we are doing as well is that patients are able to access a number of different things. A big one is the identification card. And so as I spoke about, patients are having to answer the same questions. You're in severe pain. And so they're able to bring this card to the emergency department and show it at triage, and then staff will know that they are sickle cell patients, and then that will allow them to be able to move quickly into triaging those patients, getting them seen by physicians quicker. The card, as you will see, has the patient's name, date of birth, the contacts to the hemoglobinopathy team, which is so important because that team is normally following a lot of these patients. They understand their care and they understand the nuances that's required, as well as the recommended pain management techniques and modalities that are really, really important. Patients can also access virtual appointments. And again, that reduces that travel burden that we talked about. If you're able to see your physician or your team virtually from your home or your home community, that reduces costs and time and is a real bonus for those patients. As well, appointment reminders, because we know those who suffer from chronic illnesses tend to have a lot of appointments. They tend to have a lot on their minds. Sickle cell being an inherited disorder, there are often many members in the family who also have sickle cell, and you can imagine that trying to manage appointments for these individuals, as well as child rearing, and all of those things can be extremely challenging. Finally, outside of the walls of LHSC, we are seeing folks being able to access our partners at SCAGO, the Sickle Cell Awareness Group of Ontario, that provides great support and have been great partners with our team, as well as we know that our patients are migrating from the GTA as well as through immigration. And so they're able to access the newcomer clinic to speak to some of their needs as newcomers to the area and to the country. And finally, LHSC, there's been a lot of work done, and we're expected only to see an increase in the number of sickle cell patients for the reasons that I said, through migration and immigration. And we're seeing more patients accessing care here at LHSC who have sickle cell. So while there's been a lot of great work done, as you've just heard, there's still more to do. But I would say that the partners and the teams that are doing that, the Lifespan Hemoglobinopathy Clinic, medicine team, emergency department, and the Black Health teams, we remain committed to listening to the patient voices and then putting those voices and those ideas into play and really being responsive to what patients and families need in order to get better outcomes and better experiences here at LHSC. So with that, I will turn it over to Scott Fortnum, who is the President and CEO of Children's Health Foundation. Over to you, Scott.
Thank you very much, Kathy, and hello, everyone. Really pleased to be here today. Children's Hospital has the great benefit of being a hospital within the broader LHSC. And at Children's Health Foundation, we support the activities and programs of Children's. So it's a great opportunity today for me to talk a little bit about just how we do that, what do we do, and hopefully give folks an overview of our role within the broader system. So we talk often at Children's Health Foundation about bench to bedside. We don't exist to provide care at all. We do not deliver it, but we help to support care, research, and rehabilitation directly. We raise and steward and responsibly invest donor dollars and try to ensure that funds are used exactly as intended by the donor and deliver measurable impact. So to do that, we're the fundraising arm for Children's Hospital, of course, and Children's Health Research Institute, which is part of the larger LHSC RI. And we also support at the rehabilitation end of the spectrum on the Victoria campus, Thames Valley Children's Center. So while our parents deliver care, rehabilitation, and research, we mobilize the community and the generosity that exists within our community to help make that possible. And we do that in a number of ways. Just as LHSC and Children's Hospitals serve a vast catchment area, some say it's bigger than the country of Switzerland, we are serving patients from Kitchener-Waterloo, Cambridge-Guelph, down to Windsor, Owen Sound, up to Thunder Bay and beyond. So we have families coming from all parts of the western parts of the province, and they're traveling long distances in many cases for specialized pediatric care, research-driven treatments, and it's the donor support that helps to ensure that care is going to be available in the best way possible. And to do this, we rely on a diverse and balanced mix of revenue streams. And that's an intentional approach and very important for long-term sustainability. On the traditional fundraising side, the philanthropy side, we have our major and leadership, corporate and plan giving categories, gifts from estates and large gifts. We have quite a substantial number of people across our catchment who are making smaller monthly donations, myself included, to support the activities and programs at Children's Hospital, tribute giving, and many of you will be familiar with the independent fundraising and partner events that exist in our community. And we have a number of non-traditional, but also very important fundraising sources as well, including our lotteries and investment revenue. We have a specific policy that we do not build large endowments at Children's Health Foundation. We have limits on the dollars that we will keep in our investment portfolio because we really want to see those dollars make impact and make a difference to the community and our hospital as far as what those gifts are doing. So with no single source carrying the fundraising for our organization, it allows us to remain resilient, donor focused, and responsive to the ever-changing and ever-evolving needs of Children's Hospital. Community generosity in many forms really helps to fuel better care and better outcomes, and most importantly, brighter futures for kids across our region. So this is where philanthropy becomes real. Everything we talked about so far, the partners, the geography, the fundraising, it typically shows up in four very practical ways. Donor fund supports state-of-the-art pediatric equipment, those specialized tools that Children's Hospital simply must have. In many cases, nearly all the major medical equipment at Children's Hospital is funded through CHF, through philanthropy and donor support in the community. So donors also make possible care-enhancing programs that support not just the child, but the entire family, from mental health and child life supports to rehabilitation and developmental services. And we're funding really interesting research that's helping to lead new discoveries and make care better. Again, bench to bedside. And we have direct family support. We provide wraparound supports that families often don't expect, but definitely need. Accommodation, travel assistance, legal or practical supports during some of the most stressful times of their lives. And donor generosity turns compassion into action. And this action turns into better outcomes for our kids and their family. So for me, philanthropy is not supplemental, it's essential. Nearly all of the equipment coming into Children's Hospital is funded through donor support, as I said, and this could include monitors and ventilators, equipment in the NICU, other critical care equipment, imaging and diagnostic tools, surgical and transport equipment. Having such a large region, we fund the transport team that goes out and helps to bring children in when they desperately need the care that only Children's Hospital can provide. And we also fund simulation equipment that allows clinicians the opportunity to learn and practice and better understand some of the situations that they might come across. So really, donors don't just support the hospital, you help equip it. And we fund programs that, from the voices of families that I talk to, really help make the hospital experience more palatable. Let's face it, it's very stressful for anyone, let alone a child, to be in a hospital. But with the music therapy program, the art therapy program, every donor I speak to, every child or family who has come through the hospital talks about Ollie the therapeutic clown. And of course, we have our head of hugs and high fives, Dr. Berrygood, who makes regular rounds and is always there to help families and kids and give them a hug or a high five as needed. And our good friend Gizmo. Gizmo is a wonderful golden retriever therapy dog who is doing some great work at the hospital, and we're thrilled to be part of that support. And we also partner with others. I partner with my friend Santa Claus, and Santa Claus has been working very hard with us on our annual toy drive, where doors are open until Christmas Eve at noon. So we're collecting toys, and these toys are delivered to children who are in hospital over the Christmas holidays, but they're also used throughout the year for birthdays and other celebrations, not only for the children, but for their siblings as well. So if you do want to drop off a toy, please come to our office and do so. We'd be thrilled to have it. Santa and I will be on the floors Christmas morning to follow up and ensure that all of those presents got delivered appropriately. I mentioned Children's Health Research Institute. In fact, Children's Health Foundation has been part of CHRI right from the beginning. We've got the picture that was shared earlier of Dr. Berrygood and Fezzi from Montreal Children's. Thrilled about our part in facilitating that partnership with Montreal and the rare bone disease clinic that David spoke about. This is fantastic and so beneficial for children in our area and their families. So donors, you're not just helping children today, but you're helping change children's health for generations to come. And we also fund family support. When you're coming down to the hospital, especially from far away, there can be significant financial stress and challenges managing basic daily expenses. So we can help with accommodation, gas cards and parking, meal cards, shopping cards, pro bono legal assistance, any of those things, so the parents can focus on what matters most, and that's the child's care and recovery. So donors help ensure families are supported and not just treated. We are a separate organization. As I said, we're governed by a volunteer board of directors, leaders from the community, and we have a significant impact on Children's Hospital and the other partners with the dollars that we're generating from across the catchment through generous donor support. And how do we do it? Well, we've been part of Children's Hospital since the beginning, since 1922. As I said, we have our own board of directors. We're a registered charity separate from the hospital. So we represent donors' interests independently. We maintain very strong governance and financial oversights, and we ensure that the funds are used as intended. Our funding decisions follow a formal grant to request program driven by hospital identified priorities and reviewed through our own governance structures. And we're fortunate to receive interim and financial reports regularly. So we have accountability and transparency and alignment with clinical and program needs. And we're certainly a proud part of Canada's Children's Hospital Foundations and Children's Miracle Network. This is where you'll see us in the community. We have so many activities going on, partnerships, different programs, different events. I'd urge you to participate. And of course, I would urge you to, if you're able, to support Children's Health Foundation and the work we do. You can do that at www.childhealth.ca. So a quick overview and run. Thank you so very much, and I appreciate the time. And it's now my great pleasure to introduce my colleague Tammy Quigley, Vice President, Cancer, Renal, Mental Health, and Patient Flow.
Thanks, Scott, and hello, everyone. I'm Tammy, and I have the privilege of being one of the clinical vice presidents here at LHSC. And it's really my pleasure today to speak with you about a really important step we're taking to improve how patients move through our healthcare system that puts patients first, supports their independence, and strengthens care actually beyond our hospital walls. And it starts with this philosophy called home first. And at its core, home first is really a shift in mindset, and it really challenges us to ask what's best for this patient and how can we help them recover in the most supportive environment, the one that's most comfortable for them. And in fact, for many of our patients, that's actually their home. Together with our partners in the community, Home First helps us support patients at home whenever possible with all the right services in place and facilitate early and safe return home following their hospital stay. We know that those transitions in patient in care can be one of the most vulnerable times for patients and families. And Home First really allows us to provide tools, education, and support that they need, not only to leave the hospital, but to thrive when they do. One of the key initiatives driving our Home First strategy is our new hospital to home program. I've worked in healthcare for 30 years this year, and I keep saying that this program is an absolute game changer, and I mean it. Sometimes patients are staying a bit longer in hospital, even though they don't need all of our services, and they really would prefer to recover in their own home. This makes it challenging too at the hospital for us to keep beds available for our sickest patients who need hospital level care. The new program allows us to safely send people home with lots of support to help them recover while keeping hospital beds open for those that need that higher level care. The hospital to home program started across the province in 2019. They've now scaled, and early results are really showing better patient outcomes, better staff and patient experience, and overall reduced cost to the system. So we started our program in November of 2024, and we have called it LHSC to Home. At its heart, LHSC to Home is about making sure that when people are discharged from the hospital, they're supported with care that follows them beyond our walls and into their homes, where healing often happens best. Again, we know that that transition can be a really challenging time. Patients, their families, they're worried about leaving the hospital and all the wonderful care that's provided here. And it can be really intimidating for patients and families to leave those supports. With this program, we're helping people to make that transition safely, comfortably, and with confidence. So we have a partnership with SE Health. Through that partnership, patients can receive up to 16 weeks of customized services right in their home. It's tailored to their specific needs, whether they need some rehab, they need some home visits, they need help regaining their strength or independence. It really wraps care around them, and they get to go home and they get to be in their own bed and have their own food and be with their family and their pets and all the things that we know helps them recover. On the day that patients leave hospital, they receive a phone call or a visit from a member of our team to make sure that they've arrived home safely. We have a team member visit within 24 hours, and we check in every single day of that first week that they're at home. We work closely with all of the care team members to ensure that the patient and caregiver goals are being met. And we work with other partners in the community, like your family doctor or nurse practitioner. We work with meal delivery services, transportation, equipment, you name it, we're ready to partner. Since November 2024, we've had the opportunity to care for more than 500 patients, giving them high quality care at home, over 20,000 visits. And thanks to the team, we almost never miss appointments. So just give you an example, in November, we had over 3,000 visits scheduled, and we had 0 missed visits. The program is also showing some really strong results. Almost half of our patients become fully independent by the time their 16 weeks is over. For those who still need help, we work with other programs and providers to make sure that care continues smoothly. And while LHSC to Home supports our patients, and they love this program, it also helps the rest of our community and the hospital as we try and make sure we're using our beds and resources a bit better. This means that people can recover in their home instead of staying in the hospital. It also means fewer avoidable trips to the emergency department because they're surrounded by this wonderful team. Better teamwork between hospital staff and home care providers, community groups, and just most importantly, better results for patients. LHSC to Home makes sure that care is well organized between primary care, hospital care, home care, and community services. This really supports patients through their entire care journey and reduces that pressure on hospital services that we're absolutely feeling right now in the beginning of our respiratory surge. We recently shared a story from one of our patients who benefited from LHSC to Home and the program. And we've obtained Elizabeth's consent to share her story here in her picture. She feels like a celebrity these days with all the attention she's been receiving. But she really wanted to go home. She was with us. She still needed a bit of help in order to maintain and get her independence. But she absolutely wanted to be home. And through the use of this program, was able to go home, have a wonderful team who got to know her really well. And they got to know her so well that they sensed that something was off with her over a couple of days. They were able to get Elizabeth some extra care, recognize that she had something going on with her that actually turned out to be something pretty serious. She came back to the hospital briefly, had that taken care of, and then was back home with her team. She's now graduated from the program and is fully independent, able to do all of the things that she wants to do, including, washing herself, dressing herself, and she is a bit of a social butterfly, so she's now able to participate in all those activities. As the program builds, we've also looked at other opportunities, and a really quick example is some of our folks on our team here at LHSC said, hey, you know what, we really could use this program for people who need to go home on some oxygen, but we're trying to get them down off of their oxygen. We call that oxygen weaning. Typically, these patients would have to stay in hospital, but this program now, we've just started our respiratory pathway, and that allows them to go home and safely wean off their oxygen while still being in their comfort of their home, and also freeing up some beds here at LHSC. We'll keep looking for new pathways and opportunities to increase this program because it's just been incredibly successful. The work doesn't happen alone, and just want to thank our community partners who work alongside us, and to all of you for your continued trust and support of LHSC. I'm now going to hand it over to my colleagues, Jerry Plastina, who's the Vice President for Surgery, Cardiac Transplant Medical Imaging, and Biomedical Engineering, and Dr. Sumit Agarwal, the Department Head for Otolaryngology, so that's head and neck surgery. Over to you guys, who are going to talk to us about ear, nose, and throat care at LHSC.
Thanks, Tammy, and good afternoon, everybody, and happy holidays to you and your families. So Dr. Agarwal and I have the privilege and pleasure of reviewing our ENT program here at LHSC, and we'll take the last few moments to sort of speak about the great things that are happening within the program. So ear, nose, and throat, also known as otolaryngology. This is a group that really talks about how we restore and refine your senses. This is where we help people hear, breathe, speak, swallow, and smell. This is a team that is made up of individuals of our surgeons, audiologists, speech language pathologists, the nurses, We're partnering with our cancer care teams, our pediatricians, and many others. This division within surgery looks after all patients from newborns to children, adults, and seniors. And it's not just within the sites within LHSC across University Hospital and Victoria Hospital, but we also partner with our peers and colleagues at St. Joseph's Healthcare London. And again, we're not just seeing patients within London, but all across the province. And this is a group that receives referrals from all parts of Ontario. So what do we help with and who do we help? Again, ears, nose, and throat seems pretty straightforward, but everything from hearing loss, ear infections, ringing in the ears, dizziness, balance problems, to a stuffy nose, sinus infection, nosebleeds, and smell issues. When you think about our throat and voice, tonsils, I'm sure some people that are joining us today have had children who have had tonsillectomies, but we also look at sleep apnea, hoarseness, and swallowing problems. When we look at our head and neck, lumps, thyroid problems, cancers of the mouth, throat, and neck. When we look at our pediatric patients specifically, ear tubes, tonsils, adenoids, and complex airway problems. And then from our facial perspective, we look at skin cancers and facial trauma. Now, as a service and program, this is a group that, again, sees a lot of patients. So this past year and on an annual basis, we see well over 25,000 patients in our appointments, as well as we do over 2,500 surgeries per year. With respect to waits for our patients, again, it'll be variable depending on the type of procedure that you're coming to see us for. But for examples, sudden nerve hearing loss, there is no wait times. Patients are usually seen in less than a week. Cochlear implants that Dr. Ergo is going to tell us a story about shortly, over 90% of our patients are seen within 4 months. For all of our cancer cases, 80% of our patients are achieving the established wait time standard of 28 days. And then for all general ENT areas and issues that we might be referred to, we do have some work to do still, but over 60% of our patients are achieving established wait times between 12 and 24 months. Now I'll hand things over to Sumit, who's going to speak to us about some of the research, innovation, and share our patient story. Over to you, Sumit.
Thank you so much, Jerry. Yes, general ENT has been a little bit of an issue for us, but we are recruiting a new general ENT to St. Joe's, who will hopefully join in the new year to help reduce the wait times. And we're also trying to fill a lot of our community positions with our graduating residents. In terms of research, our department does a lot of research around the city, especially developing new surgical techniques and using robotics. We also actually have 2 large basic science labs around the city. Dr. Anthony Nichols studies head and neck cancer and genetics at Victoria Hospital, and I help run a lab looking at hearing loss and cochlear implants here at Western University. So that brings me to our spotlight, which is hearing loss. And, many people in our community live with serious hearing loss, and I'm sure we have people tuning in today who are wearing hearing aids. The World Health Organization actually estimates that there's almost 430 million people around the world with disabling hearing loss. And hearing loss really has a profound effect on patients, including on their speech, school, work, and social life. And new data actually shows that hearing loss is the #1 preventable risk factor for dementia. So this is really a major health issue. University Hospital actually has one of the 4 cochlear implant programs in the entire province. And a cochlear implant is a device that we insert surgically, and it helps patients hear who have severe hearing loss and they cannot wear traditional hearing aids. So patients wear a speech processor on their ear, and that converts sound into electrical signals. And these signals are then wirelessly transmitted to the cochlear implant that's placed underneath the skin. And those signals can then go to the brain so that patients can hear. So actually, I'll just go to my next slide now and just talk about one of my patients, Taryn Armstrong. And she's actually been my patient since she was a student. I personally saw her grow up, become an educator in the school system, get married, and have 3 lovely children. Unfortunately, she started to lose her hearing over time, and she actually had to quit her job, and she couldn't even hear her own children, which created a huge amount of anxiety for her. She was then assessed for a cochlear implant in our program, and I'll let the following video tell you the story in her own words. So if we could start the video, that would be great.
My hearing went rather rapidly It's a scary thing to experience. And I struggled. Hearing is such a big part of life. Hearing your kids cry, hearing the first time they say, "I love you, Mama." All those things flood in your head. And I was like, what am I gonna miss? What am I gonna miss out on life? It was incredible, the activation appointment. And I heard that first beep, beep, beep. I was like, I heard, oh my gosh, I heard that in my ear. It was just kind of surreal, knowing that I had lost hope for so long and worried so much about the future that all of a sudden, it's gonna be okay. It is life-changing, the impact it has to be able to get customized hearing. It is going to give you back the freedom that comes with sound. And I don't even know if there's a way I could say thank you enough.
Well, I hope you all enjoyed that video. I'm very proud of our ENT department here in London. We're continuing to try to reduce wait times, and we have a number of key recruitments underway. We are also strengthening our partnerships with our community hospitals, and with our strong surgical training program, we hope to be able to fill positions to maximize the care we provide to patients in our region. I'll now turn it back over to David to finish off the community update. Thank you.
Thank you, Dr. Agarwal, and also Jerry. Thanks for that great update, and thanks for all the teams today. So before we close, I want to remind everyone we have a web form available for you to submit questions to be answered in these meetings. So you can find the link in the description on the YouTube page, as well as on the community update meetings page of our website. We also have a QR code up on the screen for you to scan, and it'll take you to a form to submit questions. Since our November community update meeting, we haven't received any new questions. So again, we truly appreciate your engagement and encourage you to continue submitting any questions you might have. So on behalf of London Health Sciences Centre, I want to wish everybody a great holiday season. And to our media partners, please join us in the media scrum right now. We will go over to it. So thank you, everybody. Have a good day.